MDMA, or 3,4-methylene dioxymethamphetamine, is a psychoactive drug derived from safflower oil, which is also known as ecstasy or Molly. MDMA yields effects that are similar to psychedelics and stimulants. In addition, they give the user a feeling of connectedness. The neurotransmitter serotonin is released and briefly hinders its reuptake, predominantly impacting brain function. MDMA is primarily taken orally and sometimes snorted. It can be found in crystal, powder, or pressed pill form. In 1912, the drug company Merck synthesized MDMA. In 1976, Alexander Shulgin used a new synthesis method to discover the psychoactive effects and shared his discovery with a few psychotherapists. In the 1970s and early 1980s, it began to be used recreationally and in psychotherapy practices. It reduces fear and increases empathy. In 1985, the federal government categorized MDMA as a Schedule I drug, which defines it among the most dangerous. It includes heroin, LSD, and marijuana. MDMA is frequently used at clubs, festivals, and concerts. Ongoing research is being conducted to determine more information about its therapeutic benefits. Absorption. People usually take MDMA as a capsule or tablet, though some swallow it in liquid form or snort the powder. Ecstasy molecules that have entered the bloodstream from the stomach and small intestines then travel to the liver. In the liver, some of the ecstasy is metabolized to inactive compounds, and the rest is carried through the veins to the heart. Distribution. The ecstasy is pumped to the lungs along with the blood, which becomes oxygenated and then returns to the heart. Oxygenated blood carries the ecstasy from the heart to the brain and to other organs and cells that have high blood flows. Generally, there is a barrier between the blood vessels in the brain and brain matter, which prohibits many drugs from entering the brain. However, ecstasy is predominantly in its nonpolar form in blood, and therefore crosses the barrier into the brain inside. It would take about 15 minutes for ecstasy to reach the brain if taken on an empty stomach. Toxic mechanism. MDMA increases activity of three brain chemicals. Dopamine causes a surge in euphoria and increased energy/activity. Norepinephrine increases heart rate and blood pressure, which are particularly risky for people with heart and blood vessel problems. Serotonin affects mood, appetite, sleep, and other functions. It also triggers hormones that affect sexual arousal and trust. The release of large amounts of serotonin likely causes the emotional closeness, elevated mood, and empathy felt by MDMA users. Symptoms. MDMA's effects last about 3 to 6 hours on average, although many users take a second dose as the effects of the first dose begin to fade. This can lead to a spike in body temperature that can occasionally result in liver, kidney, heart failure, or even death. Symptoms include sweating, dry mouth, increased heart rate, fatigue, muscle spasm, and hyperthermia. Thus, ecstasy can disrupt the ability of the brain to regulate body temperature. Metabolism and excretion. MDMA reaches maximum concentrations in the bloodstream between 1.5 and 3 hours after ingestion. Onset of action occurs 30 to 45 minutes by mouth. By kidney, the duration of action for excretion is 4 to 6 hours. MDMA stays in our system between 3 to 5 days after consumption and urine test. The traces of drug are visible for 1 to 3 days after consumption. Typically, the human body metabolizes MDMA within 48 hours. MDMA is excreted as an unchanged drug. MDMA is readily absorbed from the intestinal tract and reaches its peak concentration in the plasma about 2 hours after oral administration. Doses of 50, 75, and 125 milligrams to healthy human volunteers produce peak concentrations of 406, 131, and 236 nanograms per milliliter, respectively. These concentrations are quite low because the drug passes readily into the tissues and much of it is bound to tissue constituents. The drug is broken down metabolically, mainly in the liver, where an enzyme designated CYP2D6 is chiefly responsible. However, several different enzymes are involved in its degradation, and some of these appear to be saturated at relatively low concentrations of the drug. Consequently, as the doses increase and the higher affinity enzymes are saturated, disproportionately large increases in blood and brain concentrations of the drug occur. Therefore, small increases in doses may carry the risk of large increases in toxicity. Elimination of the drug from the body is moderately slow. The half-life for MDMA disappearance from the blood is an order of 8 hours. Since it takes about 5 half-lives for over 95% of the drug to be cleared from the body, this may explain the negative after effects continuing for 1 or 2 days after use. Some of the metabolites of MDMA are still pharmacologically active, especially its first metabolite, MDA, so that the duration of action may be somewhat longer than the duration of MDMA itself in the body. In summation, MDMA is metabolized in the liver and is excreted through the kidney. The process is slow and depends on the MDMA level along with factors such as age, weight, dosage, period of the drug, and metabolism of the person. MDMA stays in the system about 3 to 4 days in urine, up to 90 days in hair, and 1 to 2 days in your blood. Treatments and conclusion. Once use of the drug ends, unwanted symptoms will occur. Treatment will assist in maintaining abstinence from the drug, averting drug substitution, and preserving mental health. This offsets depression and anxiety symptoms. Drug addiction treatment. The support from an addiction specialist can help in determining triggers and assist in developing better coping skills. With treatment, success can be made possible through the modification of the environment. In addition, a relapse prevention plan can be created to avoid future use. Inpatient treatment is recommended for those suffering from severe addiction and/or mental health issues. This option is often accompanied by medically supervised detox with symptom management during the withdrawal period. Outpatient treatment contains many of the same features found with inpatient treatment, but permits the patient to live at home during the recovery process. Although this is the cheaper option, there is a higher risk for relapse due to the possible temptation of their surrounding environment. Medication management. Medication management can be helpful in coping with the disruption of the serotonin that occurs after drug use is terminated. The medications help regulate the availability of serotonin in the brain. These types of medications are called selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. A psychiatrist prescribes these after completing an assessment of the patient. Therapy. Mental health treatment is an effective tool that can be used to address the problems that led to the substance abuse and used to aid with the mental health symptoms that follow withdrawal. One theory suggests that people suffering from mental health problems unconsciously seek self-medication to treat or hide their underlying issues. As a result, full-blown addiction can develop. Hence, therapy can be used as a healthier alternative in dealing with their needs.
Molly, you in danger, girl.
And I can't seem to find Molly. Molly, 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 Molly.
Created using Powtoon.